Good morning and welcome to today's webcast. Healthcare organizations utilize construction audits to mitigate construction project risks. Before we begin, I'm going to play a brief housekeeping video.
Moss Adams is pleased to present another in our ongoing series of continuing professional education webcasts. Our presentation will start in a few moments. Before we begin, here are a few things to keep in mind. You can customize both how you view our presentation and how you interact with the presenter. For better viewing, close all other applications and turn up your speaker volume. You can also adjust window size and placement. At the bottom of your screen, you'll see a series of icons, each relating to a different aspect of our session. For example, you can click the file folder icon to download the group attendance sheet and a PDF copy of today's slides. You can ask our presenter questions during the webcast by clicking Q&A in the bottom left-hand portion of the icon bar and typing in your question. We'll do our best to answer all questions during the presentation or follow up via email. If you experience technical difficulty during today's presentation, refresh your browser by hitting the F5 key. We'll ask polling questions throughout today's presentation. Per the National Association of State Boards of Accountancy Webcast CPE standards, CPE credit will be awarded based on your participation in these polls. To respond to a poll, click the button next to your answer. If you're attending this webcast in a group, in order to receive CPE credit, you must complete our attendance sheet, available in the file folder icon at the bottom of your screen. Please have all group members sign the sheet, and please remit only one sheet per group. Also note, today's session will offer you one CPE credit. To receive credit, you must meet the requirements as specified by the National Association of State Boards of Accountancy. CPE credit can be awarded only to participants registered as themselves and is not available to participants who view the on-demand version. We'll track your progress and alert you when you've earned CPE credit. You can then click the certificate icon to open a PDF file you can save to your computer. We'll email a copy of your PDF certificate in 2 weeks if you can't download it today. As a reminder, the presentation you're about to see is not legal, investment, or accounting advice. We encourage you to seek the counsel of a professional service provider to apply this content to your specific circumstances.
I'm happy to introduce today's presenters from Moss Adams, Peder Jensen, Senior Manager, and Charnee Foston, Manager. Peder, I will now turn the line over to you to get us started.
Thank you so much, Emily, and thank you for everybody who is on the call today and listening to this. There is a place to ask questions, so if you do have any questions while this is going on, please type them in. We'll try to address if they come up, we'll try to address them in the presentation, or if they're going to come up further down in the slide deck, we will be addressing them then. Or at the end, we will hopefully have a little time for Q&A, which we will look at the questions. If we don't get to your question, we'll address your question. We'll respond to you after the webinar directly and respond to your questions, specifically if it is project specific or a very not kind of a broad question. But today we're going to be talking about construction audits and how to use construction audits to mitigate risk on your projects. We're going to start off with the state of the healthcare construction industry, kind of just an overall what's happening with construction in healthcare. Then we're going to talk about common exposures that we see on projects, project risk factors. We're going to talk about how you can combat some of those with both the contract that you have for the construction project and the controls around that. Also, what a project audit or what construction audits look like and what do they address, what do they not address, and the control results you can anticipate from that. So we look forward to the next hour with you guys. So, state of the industry. I think everybody has a good idea that construction right now is doing real well. It's booming. It's really picked up since over the last few years, and that's very prominent in healthcare as well. These stats in here come from ENR, which is Engineering News Record. It's a big industry index that provides a lot of information on overall construction as well as industry-specific construction. You guys can read the slide with the various different numbers, but what this means in the construction industry is that both general contractors and subcontractors are filling up with backlog if they're not already filled up. Makes it even more important for you to have better controls, contract controls, have good controls around your bidding and procurement process. That's a huge one we're seeing now is general contractors, because there's a lot of work going and the backlogs are filling up, they're trying to get more margin on projects. They're trying to bid on less projects because they have the backlog. So it's the utmost important to make sure your bidding and procurement is in place, and also that your contracts have good language around change orders and allowable costs and all of that. But in general, the state of the industry for healthcare construction is going up, and the projections are that it's going to be going up a lot more in the next few years. So we have our first polling question. As you saw in the beginning video, it's important that you respond to these in order to get CPE. Here's the first polling question. Does your company currently have a construction project? We'll give you about 20 to 30 seconds to answer, and then we will pull up the results.
So it looks like we have a good mix of different construction project phases right now, which is great. We've got some personnel who are in the planning and design and funding stage. So this is a good presentation just to kind of go over different areas that you should consider in terms of controls and auditing. Those who are currently, in the construction stage, obviously this would be of the utmost importance. Recently completed projects, those are going to be good for reviewing kind of closeout controls and future opportunities. And then obviously those with no current projects, this can help you in the future to mitigate risks on any major projects you might undertake going forward. So some common construction project exposures. You can read the list that we've provided. This is not an exhaustive list, but these are some of the most common things that we do see. Some of the major themes that kind of flow throughout this list are the control environment, both on the owner side and the general contractor side. Just having an awareness of the processes and procedures that go into the different areas. So whether that be reporting, whether it surrounds allowable cost, change order review, project funding, all of those have different controls that need to be kind of put into place to mitigate those exposures early on in the project. Reporting, like I said, is a big one, both schedule and cost. Those are going to be your major determinants for a lot of issues that might come up within your project. Contract compliance, a lot of these items that we've listed here should be specified within your contract with regards to construction quality, allowable cost, financial records, different reporting that is required, either per the owner or per state law. And then you also have just general project management. That could be on the owner's side, whether you have a facilities department who handles your oversight, if you have an external project management company, or just the general contractor themselves and the way that they kind of manage the projects. Some specific risks that we see in healthcare construction. So we've listed between the current slide and the next slide 6 bullet points. Healthcare construction is very specific. There are certain complexities to scope, technical issues. IT integration is a big part of healthcare construction. Life safety systems. With regards to schedules, There may be, depending on which state you live in, different building plan approvals that are necessary, building standards, state codes, and then there's always the, depending on the type of project that you're undertaking. So if you're undertaking a renovation or an expansion of an existing hospital, there will be different implications on current patients, on current end users, so any doctors, administrators, if it's an administrative building. So all of those things kind of have to be taken into consideration for an active building. If you're talking about new construction, then it's more of a project turnover and how to efficiently and effectively conduct that without disruption to patients and doctors and staff. There's also typically multiple funding sources for healthcare construction. You may get, private donation. You may have state funding if you're a state-funded institution. And the tracking of funds and expenditures can oftentimes be time-consuming. It's typically complex, and it might require significant oversight by your organization to kind of manage those funds and make sure that everything is being reported properly to the appropriate levels. So if you have to present something to the board, you want to make sure that you're giving them the overall statement of funds and where you're getting your funding from, how that's being used. And that's important also for public perception as well. People want, their tax dollars to be going towards kind of what they've been pitched, I should say, for that particular project. Like I said earlier, you have multiple stakeholders on your projects, and sometimes it can create some issues between end users of your work, so whether that be patients, or sometimes there can be a little bit of a disconnect between what the administration and staff of the hospital want versus what's been planned for the construction itself. And as Peder kind of touched on in his opening statements, there's considerable construction ongoing across multiple industries right now. Specifically, if you're talking about healthcare and contractors and subcontractors who specialize in healthcare, your pool is getting smaller and smaller with who you can kind of utilize to meet the needs of your project. And so you have specific risks regarding bidding and procurement of those different scopes of work. So we're going to kind of touch on some of that today. So we have our second polling question, and it is, what is the most significant risk of your organization's project? We'll give you about 20 seconds to respond.
Okay, a couple more seconds. Great, and probably if we put in all of the above, I would assume there would be a fair number of all of the aboves in there as well. Really, it really depends on the project that you currently have or the project that you're anticipating on having and what's important. Obviously, all of these are potentially significant risks, but it depends on the project and the complexity, which we're going to get into here shortly. One thing we wanted to cover real quick, and on this call, we know we have a range of people from project managers who deal with this every day to people in more of an accounting role or in a management role where they aren't in the weeds of a project and really might not be that familiar with construction projects and accounting for construction projects. So most of the projects we're talking about today are and the risks we're talking about are associated with cost reimbursable type projects, guaranteed maximum price projects, where it's not a lump sum or a stipulated sum contract. Those are usually the two main contract types that we see as either a cost reimbursable model or a stipulated sum. We're really focusing on the cost reimbursable, as that's where really a project audit comes in a factor. On a stipulated sum, the construction audit isn't as relevant unless there's significant change orders or there's something specific that wants to be addressed. We put this slide in here just to kind of cover at high level what are the different costs we're going to be talking about for the next 10, 15 minutes. We're going to be talking about real-life examples, project risk factors that we've seen on projects we've worked with. And just hopefully this will clear up, but really with a construction project, there's direct costs, there's indirect costs of kind of the two major categories. Direct costs are really anything that goes to physically building the work, so it's the subcontractors usually make up about 75% of contract costs. They're usually the ones doing most of the work. Labor and labor burden costs, that can be for subcontractors and also for the general contractor. Of course, materials sometimes are in the subcontracts and sometimes they're out of the subcontracts. Just depends if there's tax benefits to keep them out or if there's a reason why they want to be kept out. And then equipment owned and also third-party rentals. Indirect costs, this is the costs that are associated with the project but not directly go towards the work, as the name would describe. Project management labor, so this is the general contractors, project administration, project management indirect costs, and then the GC fee and markups. And different contracts have different kind of markups to allow for insurance, bond. In the state of Washington, you see like B&O tax, different items like that. And then change orders is also a cost category we include where all of those costs that we mentioned above can be included in change orders, and we'll get into change orders real quickly. So here's Charnee with our first real-life example. Oh, sorry about that. I jumped the gun one slide. And again, Charnee spent a fair amount of time talking about project risk factors. We put a couple more up here, and really what these are for is there's a lot of for each one of these, there's a lot of controls you can put in place to prevent items from having issues in specific of some of these risk factors. I'm going to call out a few, like project staffing, for example. One risk you run with a GMP contract is that the more people a general contractor puts on the project, they're getting direct reimbursement for that plus their fee on top of that. So in order to mitigate that risk of a general contractor overstaffing a project or potentially understaffing a project is to make the general contractor provide you, the owner, or your project owner representative project staffing matrix on a monthly basis with pay applications. The best way we've seen is that the owner requires the general contractor to include a project management schedule that shows by position, by person, how long people are going to be on the job for. And that should really tie up to what was proposed in the beginning of the project. And if it doesn't, questions should probably be asked. And why all of a sudden is there double the amount of project management people on this project? And it's good to have that conversation on an ongoing basis until try to wait to the end and all of a sudden realize you paid $1 million or $1.5 million more on project management than what you expected. And then the other one I wanted to bring up is the schedule impact part. We're not going to talk a whole lot about construction schedules here, but schedule impact's huge because it impacts a lot going down the line. It impacts the procurement, the new procurement for items for the facility. It impacts the go-live date, and it impacts if you're potentially planning on getting out of or closing the existing facility that you were in and you're moving into a new facility. Could it impact your lease there? Could impact the sale of that property? So schedule impacts can have a major impact for a lot more downstream. So it's another one that we wanted to mention. And here's Charnee on the first real-life example.
So we tried to choose some real-life examples that we've seen on a broader scale with some of our projects. These are specific examples, but these are issues that we see commonly. within healthcare and other industries. So the first one is subcontractor overhead and profit markups. This is particularly within change order work. This particular project that we audited was a $26 million project. The contract had very specific terms about allowable overhead and profit markups within change orders. It was to be limited to 15%. It was very specific with regards to what that 15% covers, and that's something that's going to be vitally important both on an owner and on the contractor side. You want to make sure that what's being included within your overhead and profit, or if it's a general contractor, the fee, is indicative of what the contract would allow. So this particular example allowed 15%, mostly covering home office related costs of that subcontractor, including cell phones, auto allowances, different components such as that. And within their change orders, they actually ended up charging somewhere between 20 and 30% depending on the subcontractor. It can be particularly important on a subcontractor basis since the majority of your subcontracts are typically going to be lump sum. You really don't have the opportunity to look at that cost in the same amount of detail that you would if you had a GMP contract or subcontract. And so since subcontracts account for 70 to probably 85% of your total contract value, it's vitally important that you take the time to review your subcontractor change orders and your owner change orders for compliance with these types of risks. So like I said, in this example, they were allowed 15% overhead and profit, and they charged anywhere between 20 and 30%. Through an audit of the subcontracts, we actually ended up finding just over $191,000 of unallowable cost, to which the owner was reimbursed by the contractor for the contract noncompliance. That may seem like a small dollar value compared to the total contract value, but this is one specific issue for a project that has multiple other issues related to other areas. And I think what we really wanted to be able to highlight in these real-life examples is some of the preventative controls that can be put in place by the owner and or the general contractor to ensure that you're minimizing these risks as much as possible. For this particular example, having change order template documents can be really important. I've seen a number of subcontracts or even prime contracts that provide template documents to show, and they're specific to the contract terms. So if the contract says you get 10% overhead and 5% profit, those template documents will be set up in a way that shows that those are your maximums. And then anytime a subcontractor goes to submit a change order, they use that template document. A lot of times what will happen with documentation is it's filled out by a subcontractor using whatever system they typically would use. But on any given project, they may have different markups that they're allowed depending on whatever their contract states for that particular project. If they don't update that for your specific project, that's kind of where the risk comes in that you may be overcharged for something unintentionally due to however they kind of manage their own change orders. So having change order template documents at the very beginning of a project could be something that could really prevent those types of overcharges, and it really helps to streamline the process, knowing that each and every subcontractor is going to be submitting to you the same form document. Also, a detailed review by the general contractor of any subcontractor change orders should be conducted. They should be reviewing sub changes for Obviously, scope. You want to make sure that the scope is in line with the project needs. You want to review it for, you want your general contractor to review it for labor rates. You want to review and ensure that everything that they're including within their change order is necessary. You don't want to see any excessive costs related to overhead or general expenses, or depending on the type of change, unnecessary equipment, unnecessary materials, anything that's being delivered to a project yard and not to the project. You want your general contractor to review, or if you yourself as an owner have someone who's responsible for reviewing payment applications or change orders, you want a detailed review to be conducted so that you can catch these types of unallowable costs before they've been billed and before they've been paid. It's a lot harder to recoup any money after dollars have been paid out. My second example here surrounds labor burden. This particular project was a $112 million project that included just under $3 million of labor and burden costs. We audited, I guess I'll step back. So when you conduct an audit, you always want to get as much information as you can about your contractor and subcontractor labor rates that they're charging to your project. This example is specific to subcontractors, but you can certainly do the same things for your general contractor under a GMP agreement. So this example is a subcontractor that provided a labor rate and labor rate burden breakdown. You review these for certain cost components. Obviously, you have your taxes, your fringe benefits, and then they may have some other kind of miscellaneous charges that they bill within their labor burden. This example, and I don't know how well everybody can kind of see the graphic that's there, but there were quite a few things that were included within this labor burden rate that were covered under another area within the project scope. So like computers, auto allowances, different, basically everything that's under the office expenses category and the other burden category. Those costs were allowable project costs, but they had been billed directly to the job and shouldn't have been covered within the burden that's charged. Kind of reviewing those different components of each of the subcontracts that we looked at, we ended up finding about $268,000 of unallowable burden costs, which is just shy of 10% of the total labor-related costs that were billed to the project. The labor burden rates should be confirmed with actual cost, where you can do that. I know with subcontracts that can be a little bit more difficult, especially if you have a lump sum subcontractor. But what you can do as an owner or as a general contractor is you can request at the beginning of the job, when a project is bid out, that labor rates and their breakdowns be provided as part of the bid. And you can use that as a way to negotiate, what the rate should be. And you can also use that for comparative purposes to see, what's the typical burden rate of an electrician or a plumber or a waterproofer. If you've already started your project and you can't obviously go back and do that at this point in time, then I think you can still review a breakdown. It should still be provided. And you can still review it for allowability per contract terms. You want to make sure that there's no duplication of certain items. So if you're paying computer rental costs on a monthly basis, then you shouldn't expect to see that within the labor burden rate. And that's pretty similar for any of those kind of other expenses or other burden charges that they've included within that example rate that we provided.
And just to follow up on that last slide real quick is one thing that just the red flag right here that kind of set everything off for us was if you look at the labor rate is $36.74 for this example for this foreman, and then the burden costs are $44 and some change. Really, burden makes up more than 50% of the total labor cost. That's a red flag for us. I think traditionally we see somewhere between the 28 to 35% of total labor cost is labor burden. So usually when you see a percent that's that much higher, a red flag goes off that there probably is more cost in there that's actually than actual what we would consider true labor burden, which is the taxes and insurance. On to our next real-life example. This is in regards to lump sum general conditions. On some projects, we see owners that they favor lump sum general conditions. There's obviously some advantages to it, as there is some disadvantages to it. It just really depends on what risk and how you want to structure your contract. But so for this specific project, it was a little bit over $600 million. It was a construction of a new hospital tower. The general conditions were $72 million. And one thing this owner did really well is that they had the right to review the general conditions costs before they were agreed to. So they actually brought Moss Adams in to do an audit. We reviewed the general conditions. We identified $21 million of unallowable or excessive costs. Now, some of those costs we said should be considered direct cost items and not part of the lump sum general conditions. The final general conditions was $54 million, so it was an $18 million adjustment. I think the big dollars in that were there's some labor burden costs that were unallowable. A lot of it was in equipment. All of the equipment was in the general conditions, and there was a lot of excessive equipment cost in there. The controls that really an owner should adopt if they're going to have lump sum general conditions is some type of matrix or schedule should be created to identify what costs are part of the lump sum and what costs are part of the direct costs. This is really important because as you're reviewing, and this is very important to establish at the very beginning, because as you're reviewing the payment applications, as you're reviewing the project costs as they come in, it's critical. So if somebody bills for forklift rental, should that be in the direct cost or should that be in the lump sum? Because once you agree to those lump sums, they're going to bill that on a percent complete basis, and most likely you're going to have no chance to review any of the costs in there. So really, if you're having lump sum general conditions, reviewing those before you agree to the final amount is critical. Also, where lump sum general conditions becomes the problem is with change orders. So change orders, depending on the type of change order, sometimes general contractors are entitled to general conditions. A lot of times if the schedule is impacted, meaning the project's going to go longer than anticipated due to a change order resulting from an owner change or design error, if it's a bid build job, having rates or what's allowed to be included as far as general conditions in the change orders is critical. Understanding what's in the lump sum general conditions. So, for example, equipment's a good item. If the project schedule gets extended and they have a pickup truck on site, that pickup truck's not costing the general contractor any more money. And if the project's gone, so for example, this was like a 5-year duration project, a $600 million project, that pickup truck has probably already been paid for within the first 6 years. So if the schedule extends 6 more months, there's no more, or the additional cost to the general contractor is very minimal. It's probably maintenance, licensing, registration, items like that. It's not for the actual value of the pickup truck. So that's kind of what this one's kind of getting at. If you do have lump sum general conditions, it's very critical to review those at the beginning and also understand what costs are included in there, what costs are included in the reimbursable portion of your contract, so you don't get cross billings. Our final real-life example has to do with contractor-owned equipment. This probably is one of our areas where we see the most issues with is contractor-owned equipment. So what happens on a construction project is the general contractor a lot of times has a lot of equipment they own as a company. Some of it might be brand new, most of it is usually used or from other projects, and it comes onto the project, and then the general contractor bills on a monthly basis a rental amount. So there's really a couple things that should be identified. There should be a rental rate in the contract on a monthly basis. Should be in the contract language, should include what's covered in that rental rate. Is it just for the piece of equipment? Does it also include maintenance? It does it very rarely, but occasionally with cranes and different lifting apparatuses. It'll include operator time, potentially oiler time as well in there. But most likely like pickup trucks, laptop computers, skid steers, bobcats, those kind of items don't include, they usually include maintenance, but they don't usually include operator time in there. But those are things that should be well established in the contract. For this specific example, it was a $32 million project. Monthly rental rates were established in the contract. So it was by item, how much they were allowed to charge on a monthly basis. The contract did have language establishing maximum caps by item. And by item, what we're talking about there is, so for a pickup truck, if you're renting a pickup truck and the monthly rental rate is $1,200 a month, what is the cap on that piece of equipment? Most likely in the standard contracts or the AIA type contracts, it establishes that rate at the value of the piece of equipment less salvage, or the value of the piece of equipment when it comes onto the site less salvage is the maximum value. So for a pickup truck, if a pickup truck brand new is $25,000 and it was brand new on the project, and after a 2-year project, the pickup truck, you can use there's a lot of different indexes out there to use, but let's say it's worth $10,000 after that. Really the maximum value should be $15,000 of rent for that pickup truck. On this project, that's exactly kind of what we were looking at, is we looked at all the pieces of equipment. The owner in this specific project was charged $200,000 over the value of the combined pieces of equipment. A credit was actually given to the owner for just over, I think it was $202,000 for this specific example, where we saw, like, for example, laptops, which usually have a cap value of somewhere between $1,200 to $1,500. Laptops, total rent charge per laptop was in between $8,000 and $10,000 per laptop on this project. So those are examples where the owner basically paid for that laptop 4 to 5 times over, and luckily we were able to catch that at the end of the project, and there was credit given. A couple big critical things here, though, and some ways to avoid this, is at the beginning of the project is establishing those caps. One important thing about establishing those caps is establishing the value of the piece of equipment when it comes onto the project, and also with the projected end, establishing what the salvage value is going to be. And it's a lot easier to agree to those with your general contractor at the beginning of the project and establishing those caps than at the end trying to fight over what the value was, because most likely, like in this case, the owner had already paid the general contractor the $200,000 over what it should have, and then it had to go through negotiations trying to establish what the value is and what the cap is. The beginning value should be the value of the piece of equipment when it entered the project. So for example, a lot of general contractors will, if they're bringing a forklift onto a project, that forklift might be 10 years old. It might have been used on previous projects, that's not a problem. It still can serve the functionality of what you need to do on your project. But when we're establishing the total reimbursement the contractor should get, they shouldn't get reimbursed as if it was like a $100,000 brand new forklift. So really, the beginning value should be established, or the value should be established at the beginning of the project when usually the general contractor is more willing to negotiate with you and more willing to work with you on these kind of items. And then another critical thing is also to establish those values, and also throughout the project, making sure you're getting enough information about the pieces of equipment. A lot of times we'll see general contractors switch pieces of equipment out and then start billing again. So let's say for the pickup truck, let's say they have a person on the job for 8 months, and then he switches out and a new guy comes on to replace him. So the superintendent was on the project for the first 8 months, and now you got a new superintendent that's maybe more for a specific trade, and then he brings his new pickup truck. As an owner, should you be paying for that new pickup truck when you've already potentially paid most of one pickup truck off? Things like those are items that you want to establish, and also get enough detail so you can identify those as the project's going. So this is our last slide on project risk factors and, again, the controls around them. A couple I'm going to talk about here is excessive change order cost. This is a big one in where general contractors, and I spent about 6 or 7 years working for a general contractor specifically with pricing change orders. It's an opportunity where general contractors can include additional costs or make up for costs they might have missed in their estimate, or they can be billing for things that might not be part of a change order. It's very important as an owner to have controls in place where you know what change order costs are coming up and what your potential exposure is, and that they comply with the contract language. So for example, some controls around avoiding excessive change order costs. Owner meetings are huge. Addressing all potential claims in owners meetings. A lot of times owners like to have meetings, whether it's on a weekly basis, bi-weekly basis, monthly basis. They're critical to address any potential upcoming changes. The quicker you can get out in front of those changes, or the quicker you can address those changes, it usually lessens the impact, total dollar impact. Also gives you a chance to potentially value engineer or change design if that's coming up, which can again mitigate costs. And then also a proper review of the change order, making sure that whether it's your internal construction group, the project management group, or your outside project manager, your third-party project rep, your architecture firm, or if you have an accounting firm that can come in and help you review the cost. One, make sure that there are actual costs around that specific change. They're not duplicated scope or duplicated costs that were included in the original contract or previous change orders. And also make sure that those costs that they are including in there are comply with contract language. Very often do we see a subcontractor include its original bid margin on the change order, which that's great. They could do that on the original contract. They can put whatever margin they wanted because hopefully there's a competitive bid situation. But when you're reviewing a change order, it's a sole source negotiation at this point, where it's really important to understand what costs are allowed in there, what kind of markups are allowed, what percentages. Are they putting in insurance costs when there's potentially an OSIP or a CSIP on the project, which is owner-controlled insurance program or contractor-controlled insurance program, which then a subcontractor should not be putting any insurance costs in their change order costs. So items like that's a big one. And then we talked a little bit about excessive rental equipment costs, but it's having the controls around that, establishing the value of the equipment is critical. So going into our third polling question, who is responsible for the mitigation of construction projects within your organization?
Great. So this is another good mix of results. The next couple of things that we're going to talk about are items that can be and should be incorporated into your construction project controls It can be work that is done by any of these parties or multiple of these parties listed within the results. So your construction contract is your most important document. A standard document that we always suggest to people and one that we see most often is an AIA contract, which is American Institute of Architects. It usually comes in two parts, a 102 and a 201, and that basically outlines the terms and conditions of your contract, and then it also specifies your allowable cost items, specifically identifies costs that will not be reimbursed. It discusses payment, submission of applications for payment, submission of change orders, documentation that's required to support both of those, as well as outlines your insurance requirements and any specific terms and conditions of your particular contract and for your specific project. There's a lot that can go into a construction contract, and it can be and should be as specific as you can make it to fit your particular situation. We always, as construction auditors, we always refer to the right to audit language, which should be as specific as possible, and it shouldn't include any limitations. This is an area where it's good to be as specific as you can, but also kind of have some overarching language that states, anything that pertains to this particular project can and should be subject to audit. As far as project controls, payment applications and change orders are going to be your two primary sources of submission of billings and setting up budgets. And so you kind of want to verify that the work that has been billed has actually been completed, whether that's through an on-site walkthrough on a monthly basis, just to view kind of does what we're being billed for align with work that's actually been performed? Any materials that are being billed for, are they actually on site? Are they being stored properly? You want to review all the costs to make sure that they're supported and allowable. I know on some projects, due to time or volume of documentation, it may seem impractical to receive actual cost support for everything that's being submitted, but you should be reviewing that on a monthly basis, whether that's time cards, receipts, invoices, anything of that nature. You want to make sure that you're reviewing that every month so that if you see anything that seems unallowable per the contract or seems to be not aligning properly with the scope, you can catch that in real time rather than waiting until the end of the project to try and address those types of items. Additional documents that you're going to want to look at: schedule. You want to review a change order log, contingency or allowance usage log. You want to look at your lien releases to make sure that payments are properly flowing all the way down to whatever tier of subs you have. You may have second or third tier subs. You want to make sure that they're receiving their payment as well. Equipment, which is something that Peder kind of talked about. Your cash flow forecast. And you want to compare your cash flow to kind of your work completed and your schedule, just to make sure that everything's kind of jiving and flowing in the correct direction, and that your funds are going to meet the schedule. And as Peder kind of talked about, the change orders, you want to review them for the reason of the change. Just make sure that it's appropriate. Make sure that it should be funded by you as the owner and not coming out of contingency or being back charged to a subcontractor or something of that nature. You want to avoid duplication of scope and make sure that you're not paying for something that should be included within the base scope of work. This is our final polling question. What control is most important to ensure a successful project?
We'll give about 10 more seconds. Great, some good answers. I would completely agree with the well-defined contract terms. I think spending the time up front on the contract probably is where we see owners potentially not spend as much time as they probably should on this, or consult with the right types of people. A lot of times we get brought in for these kind of things, or construction auditors get brought in to help with contract terms at the beginning. It's a lot of times a great service that can lead to a more successful project. And also the internal controls and policies and procedures, I think, go right along with that. Having good policies and procedures specifically around how you're going to do your procurement, how you're going to, how the design goes of the project, and also the closeout of the project. And I know in this presentation we didn't talk a lot about the procurement side or the design or the closeout. We really talked about in construction, what are the risks with construction costs. But there are a lot of things around policies and procedures you can have for project closeout and project startup that are critical for your project. Okay, so our last couple slides are around what is a construction audit, what is a project audit, what we're talking about. We've talked about it. Really, a project audit or a construction audit can cover a lot of things. It can be very specific and cover one risk exposure. So, for example, if you feel like change orders are a big issue, you keep getting change orders, you don't know if you're reviewing them properly, you can have a construction audit specifically focused on just change orders, or it could be for the entire project cost, which is probably the most typical. But really, the risk factors are the same risk factors we've talked about throughout this presentation, and the costs we're going to review, but it's really potentially any reimbursable cost that's billed in the project. There's a chance where, one, it doesn't comply with contract language, that it's excessive, that it is not allowable. So those are all things that should be addressed by your construction auditor. I think the most important thing when picking a construction auditor, or when you're going out and looking for construction audit services, is really understanding what the team is, what they do. Is this something that they focus on 100% of their time? Is this something they do on a part-time basis? What's their experience? Those are really important, because the experience and the knowledge of your construction auditor is just as important as the knowledge of your project manager, or just the knowledge of the superintendent that's building the building in what they're trying to accomplish. Audit scope, so timing. We get asked often about the timing of projects. Really, you can bring in a construction auditor at any time. Probably most common is an initial, a midpoint, and a closeout, and that really depends on the size of the project. The bigger the project, obviously, the potential you might want more touch points. A lot of times, if we get brought in just for a closeout audit, you could still have some great findings and some great work. The only issue is then we're talking about costs that have already been fully incurred, and then we're trying to get costs back that have probably already been paid. By doing an initial or midpoint audit, a lot of times what you're doing is, one is you're identifying costs that were billed incorrectly, but if, let's say, you do your initial audit at 30 or 40% complete of the project, it gives you a chance to not let those billing practices continue for the rest of the project, which is huge. So hopefully you get that money back, but it's a lot easier preventing incorrect billing practices than asking for money back from a general contractor. A lot of times they're a lot more willing to cooperate or change or put caps on things early on in the project or while the project's going than at the end when it's really just a cost recovery or a cost identification. Anticipated results, all of these are potential. Obviously, costs are a big one in preventing unallowable costs, but having tighter controls around change orders, having improved communication, whether that's with your general contractor or just internally, as far as like if we're looking at a program, what kind of reporting is going to management, what kind of reporting is going to external stakeholders, all of those kind of things can be looked at in a construction audit. So these are all different areas of scope, and if you guys do have any questions about specifically if a construction audit could help you, please reach out to a construction auditor, whether that's Moss Adams or it's another firm. If you have a project, I think it's worthwhile at least having a conversation with an auditor to see what the options are and if you think you have those risks covered or if you think you might need external help for that. So I'd like to thank everybody today for being on this webinar for ours. A lot of these next steps we've kind of touched already, so I'm not going to read down the list. But if anybody has any questions, I think we have about 5 minutes. We'll do a quick Q&A. Emily can refer to the questions that we have. And again, if you guys do have any project-specific questions, please reach out to Charnee or myself. We'd be happy to talk to you or just answer any questions. Thank you again.
Great. Thank you, Peter. It looks like we do have a few minutes here for questions. If you have a question for our presenters, you can reach out in the Q&A box to the left of the screen. Just enter your question and click Submit. So our first question is, what are the next steps after the audit report is provided?
So, yeah, that's a great question. So really through an audit scope, kind of the last deliverable usually is providing the audit report and maybe a presentation to management or to the board or something of that nature. But really that's kind of not the last step of the entire process. Hopefully if it's a closeout audit, really what that is you're doing that right before retention is released. So it's somewhere right before substantial completion or right after substantial completion. So you still, and the reason I mentioned the retention is you still have a lot of leverage when you're holding potentially a couple $100,000 to millions of dollars in retention of the general contractor. They're looking to get that, to get the project wrapped up and closed out. So hopefully you do that audit before then. But when we try to provide a construction audit report, we usually try to vet it through, we always vet it through the general contractor first to include their responses in the report. A lot of times general contractors will agree on things where they potentially just say, yes, we'll provide a credit. But then there's also a lot of times where they see things differently or that there's an issue. And those are the ones that probably it either becomes a negotiation with the general contractor, it can become a legal issue. I'd say it's rare, but occasionally it's where both sides might see a contract language completely differently or in different interpretations of the contract, so that there needs to be further resolution. But what hopefully you get is in your audit report a very comprehensive, detailed, well-supported observations or write-ups that give you the ability to go to your general contractor and talk with them and have the communication about why you think those costs or the issues brought up in the audit are valid. So hopefully that answers that question.
Thank you. We probably have time for one more here. Is any of this covered by my financial audit? That's
a great question. Your financial auditor, which Moss Adams is also a financial audit firm, so they do a lot of this kind of stuff, doesn't get into anywhere the kind of detail that this does. They really look at the construction costs at a fairly high level, so the items that are brought up in a specific construction audit are not going to be things that are going to be found or looked at by your financial auditor. Your financial auditor is doing a lot more with the balance sheets, financial statements, and they're not getting in the details of the actual construction cost billed from the general contractor to the owner. They're just making sure, usually they're more making sure that things are accounted for properly on the owner's end, but they're not looking at the construction contract and going through those kind of details. So no, it's usually not covered by a financial audit.
All right, thank you. And that is about all we have time for today. If we did not have time to address your question, we'll be happy to follow up with you via email after the webcast. And thank you, Peder and Charnee, for a great presentation today. As a reminder, if you attended today's presentation in a group and would like to receive CPE credit, you must complete the group attendance sheet found in the slide deck and handouts window to the left of your slide view. If you participated as an individual and met all certification requirements, your certificate is available to download now in the CPE progress window to the right of the slide view. I'll keep the webcast console open for a few minutes to give you a time to download your CPE certificate. A copy of your CPE certificate will be emailed within 2 weeks should you have any difficulty downloading it now. Here is a link to an online survey where you can provide feedback for today's presentation. Please take a moment to complete this survey as your feedback is very important to us. Thank you for joining us, and we hope you'll join us again next time.